Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey everyone, thank you for joining me today on this episode of the Gastro Girl podcast. Today I've invited Dr. Megan Riehl to join us, and she's going to talk about the role GI psychologists play in patients' care. Dr. Riehl is a GI psychologist and assistant professor of medicine who specializes in psychogastroenterology and anxiety-related disorders. She's the clinical director of the GI Behavioral Health Program at the University of Michigan, and we're so honored that she's also GIOnDEMAND's Director of Behavioral Health Services. I'm so excited to have her here today to share her expertise with us. So let's get started. Hi, Dr. Riehl. How are you?
I'm good. Hi, Jackie. Thanks for
Hi.
having me.
This is so awesome. We have so much to talk about today. And, you know, our main mission at Gastro Girl is to help our patients achieve optimal digestive health. But that doesn't always mean we focus just on the gut. There is a whole ecosystem out there. And as you know very well, there's a very strong connection between the brain and the gut. And that's where GI psychologists like you come in. Dr. Riehl, can you first give us an overview of the brain-gut connection?
Sure. So it's something that we're all familiar with, that, we all have a brain-gut axis, and that's oftentimes something that patients hear about and wonder what it is and how it impacts their symptoms. And so recognizing that your brain and your gut are constantly communicating, and in patients that have digestive conditions, sometimes that communication gets a little bit wonky. So especially during times of stress, our gut can produce different hormones that can flood the system that can lead to worsened GI symptoms. And the gut then also can send signals up to the brain, and the brain can have a hard time doing what we call down-regulating. So down-regulating, turning down pain or symptoms. So as a GI psychologist, one of the things I help patients to do is, one, recognize the role of that stress, and then two, learn different strategies to help manage it.
So that's really interesting. So can you explain for those of us who may not know, what is the key difference between a GI psychologist and just a general psychologist?
Yeah, so as a GI psychologist, our job is to really hone in on tools and strategies that help you manage your GI condition. Whereas a general mental health provider is going to be someone that's going to provide you with resources and treatments to manage mood symptoms. So anxiety or depression that's driven by many life stressors or life situations is something best dealt with by a general mental health provider. So we really sometimes have patients that have both of us. They work with a GI psychologist to manage the GI condition, and then they see their general mental health provider for any mental health condition that they might have.
Oh, great. So another question along those lines, how would a patient or their healthcare provider know when it's appropriate to work with someone like you?
Yeah, so when your GI symptoms are causing you stress and you're struggling with how to manage those symptoms, and you're looking for a non-pharmaceutical option to manage your GI condition, our GI behavioral therapies, and we call them brain-gut behavioral therapies, are really wonderful strategies and interventions that can target your GI symptom. So if you're working with a gastroenterologist and you have irritable bowel syndrome or GERD or inflammatory bowel disease, and you're looking for different resources to help manage those conditions, we can certainly jump into your treatment plan and join the team. So we very much work from an integrative perspective with your gastroenterologist, or if you're working with a dietitian, they might be on the team too. So if you're looking to build your team and find different ways to address your GI condition, then that might be time to work with a GI psychologist. But I will say, as you talked about the differences between a general mental health provider and a GI psychologist, if you're having more severe symptoms of depression or anxiety, it's really first important to address those symptoms and stabilize those mood symptoms. So I recommend working with a general mental health provider first to stabilize the mood symptoms, and then looking at building other team members that might include a GI psychologist.
Great. Now, is there a resource that you recommend if a patient was going to look for another type of mental health provider that you recommend?
Yeah, so to find a general mental health provider, there's a website called psychologytoday.com, and you can put in your zip code, your insurance, the types of therapy that you're looking for, the mood symptoms that you have, and that'll pull up different mental health providers in your area.
Now, you've done a great job on GI On Demand of really creating a strong offering for not only patients, but providers to understand the role of behavioral health in managing GI conditions. And some of the tools that you've developed include screening and assessment tools for providers to know when and if behavioral health through a GI psychologist is appropriate. And also, you really help address, which is a reality right now, especially given the post-pandemic stress that's been put on GI psychologists and the mental health community in general. It's really, oftentimes there's a long wait to see a GI psychologist like yourself.
Mm-hmm. Yeah, so certainly go to GIOnDEMAND.com and kind of follow all of our resources that we've developed. As a gastroenterologist, we have, like you said, screening tools to help make that decision of where to go. But as a patient, you can also utilize those resources. And I'm really excited. We've brought on our platform right now world-renowned GI psychologists, experts in what they do. So you can kind of receive some of their insight through our educational webinars right on our platform without having to leave home.
So this is you just did a great segue into my next question, Megan. You've developed a really wonderful offering of these online free webinars for patients and providers. Can you explain some of the courses that you and your colleagues have developed?
Yeah, so these introductory courses are very much built for somebody that's either newly diagnosed or really just wants to learn more about their condition. So the webinar that I've developed that deals with stress and GI conditions is really that. It's learning more about how stress can impact the digestive tract and impact several different GI conditions. And I think it's a great place to learn and then decide where to go next. So that's a really nice introductory webinar. I've also worked with the team to develop one on celiac disease and some introductory information about that. And certainly one of my favorite things to teach is diaphragmatic breathing, because it's such a benefit across the spectrum of digestive conditions, stress, anxiety, life. So we've got a really wonderful introductory demonstration of diaphragmatic breathing that's going to be available. And then my colleagues. So like I said, I've got some amazing colleagues that have put together really wonderful webinars describing some of the interventions for various conditions like inflammatory bowel disease. We have a wonderful webinar by a pediatric GI psychologist talking about pediatric distress and GI conditions, some sleep information that again is great for everybody. GERD is covered, so heartburn. So we really have some wonderful offerings for a variety of GI conditions and also how our brain gut behavioral therapies jump into the treatment planning.
Yeah, and we just talked on our previous podcast episodes to Dr. Mark Weisberg, who did a great course about pain management, and Tara Cousineau on kindfulness and mindfulness in your GI condition. And those are also available, as well as podcast interviews with those experts as well. So we've got so much great content, and that's available at education.giondemand.com. What are some of the tips you would offer patients who may be feeling stressed out or feel anxiety about their GI condition, especially now in the state of what our society is going through? People are really struggling, not only those with digestive issues, but maybe without, or maybe they're related and people are experiencing some GI symptoms as a result of their stress and anxiety. So what tips do you have for them?
My first is just acknowledging and asking yourself, how am I feeling? How am I doing? And if the answer is that I'm feeling stressed, starting to take an assessment of what might be contributing. Is it that work is really stressful, or parenting, or relationships? And that can kind of help guide, do you need to work with a general mental health provider, or is it that a lot of your stress comes from your health and your GI condition? Be open to having conversations to find that help. So it might be a little bit anxiety provoking to bring up your anxiety or your mood symptoms to your gastroenterologist, but they may be a resource for you to give you different recommendations for therapists in the area that come highly recommended. But certainly not being afraid of asking for help or support. Maybe a friend has been seeing a therapist that works in a group practice that comes recommended. So take into account that lots of people are looking for resources for their mental health right now, and we can't help you if you don't start to talk about it. So being open is really one of my big tips.
So that brings me to my next question. And, it might be kind of repetitive, but I want to drill this home for our patients today. Patients at the end of the day may feel intimidated about speaking to their gastroenterologist about their mental health. Do you have any other suggestions about how a patient could go about asking their gastroenterologist for help?
Gastroenterologists are starting to recognize more and more that a patient's emotional health is just as important as their physical health. And so they're a lot more comfortable having these conversations than you might think. So give your gastroenterologist the benefit of the doubt and speak up and advocate for yourself that you want to talk about this. I also encourage you, some patients have had really negative experiences in the past. So if you're working with somebody new and just because it didn't go well, the conversation didn't go well, or you didn't feel validated or heard with a previous provider, chances are you've found a different provider that is maybe more thoughtful around these issues and also more open to having the conversation. The gastroenterologist isn't going to be your therapist, but they might be able to connect you with some really wonderful resources.
Oh, thanks, Dr. Riehl. This is so awesome. I really want to thank you so much for your time today and for doing so much to help patients manage their GI condition. You've done amazing work in the field of psychogastroenterology, and we're so grateful to once again have you on our podcast today. And listeners out there, check out the education offerings in education.GIOnDEMAND. There's amazing behavioral health courses and insights and resources. And also don't forget to rate, review us on your favorite podcasting app so we can keep providing a platform for these amazing patients that we've interviewed so far, and also to keep bringing on experts like Dr. Riehl. So thank you so much.
Thanks for all that you do, Jackie. You are always a wonderful advocate for patients. We appreciate it.
Thank you so much.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.